Hi, welcome to RCC Connections. I'm your host, Kathy Cheek. We thank you for watching, and this time we're going to have some really exciting news that is going to affect healthcare in Rockingham County, and it starts right here at Rockingham Community College, and it will be coming very soon. We want to talk to Dr. Jan Overman. She's the Vice President for Academic Affairs at the college, and she's going to tell us exactly what is all this excitement about. Jan?
Good afternoon, Kathy, and thank you so much for coming to RCC today. We want to talk with everyone about our proposed simulated hospital that we are looking forward to building here at Rockingham Community College. What we know in clinical education for all of our healthcare disciplines, it has become so technologically advanced that we need to prepare our students in a different way through new and innovative clinical education.
For example, we can create an actual situation. Let's say a patient has an emergency situation, EMS would bring them to the ambulance bay, a couple of paramedic students, EMS students, nursing students would meet the patient there, if you will, take them through the triage, take them through the emergency room where you'll have respiratory therapy come in and perhaps administer a respiratory therapy treatment. Phlebotomy would draw blood. You would have your medical receptionist take in health information. It's really going to be exciting because students could actually experience every aspect of sort of point of care from the time you arrive at the hospital until you're discharged. So we're excited about being able to provide that type of experience for the students.
Simulation now is so advanced that the faculty member can create what we call a simulated experience, and they can program such advanced mannequins that the students and their colleagues can walk in, they can assess a patient, the faculty member can create a scenario so that they know a student is ready to enter the clinical world with these specific skill sets, which you can't always create in a real clinical situation. So our students, when they do go to an Annie Penn or to Moorhead, they are prepared, they certainly have had the clinical experience, and they're ready to interact in a real life situation, and they're prepared.
So Jan, you were telling me this is really going to affect students in all areas of the college, not just health sciences.
Absolutely. As you'll see from the graphics, as you'll look at our simulated hospital, when you build a hospital and health care, for every one nurse or every doctor, there is a team of healthcare providers that surround quality patient care. We will have students from our medical office area. They will be skilled in computer information technology. We will also have our EMS students, our fire protection students, and all of this, the other students who can work within a facility to make a facility safe, which would even include our industrial technology students. Of significant interest is our horticulture students. We have planned with our development here of our simulated hospital a healing garden, which is, you will see in all major hospitals now, a quiet respite place for staff, for students, for patients' families to go and have an outdoor space for some quiet time during a very stressful period.
So even your horticulture students are going to have an impact on this?
Absolutely.
And just caring for the building, like you were talking about, like some of the students who do HVAC.
Right.
will have some hands-on experience.
Because, for instance, you know that in a hospital, your pressure flow for isolation rooms is totally different than in just regular buildings.
Okay.
So that's another place that we can have some exposure.
And when do you expect to start on this big project?
Well, of course, this is a major project, estimated over $3 million. So, of course, it will have to be phased, and also very dependent on our contributions that we'll have from our community partners. The phase 1 will involve the starting of building on the first level of the existing Owens building that we have now. And that will be the Starting in May of 2013, we will have the deconstruction part of our existing facility with a relocation of classrooms and some offices that are currently there. Our first phase 1 project will involve the building of a nursing lab and 1 OR. And then phase 2 will be other sections of that. And again, this is all our proposed areas. With the final phase probably being the large atrium that you will see as you enter the facility and the front wall. But really excited, there'll be walls for donors. There'll be a donor wall. There'll also be computer areas for students to practice. There'll be observation areas for students to learn through observation as well as actually doing the facility. So there will be a lot of spaces, and the phasing will be dependent on those specific needs at that time.
You were also telling me that this is going to have an impact on the healthcare community beyond just training students. So tell me a little bit about that, how it can impact all of Rockingham County and the professionals that are already working in healthcare facilities.
That's right, Kathy. What we're seeing is healthcare workers have to undergo professional development every year. Healthcare is changing very rapidly. All of our healthcare workers, whether it's Annie Penn or Moorhead, or even in our physicians' offices or first responders, they all need to go through professional development. What we can offer them is a safe, simulated hospital where they can bring their employees, their staff, and they can run simulation professional development that they're required to do so on an annual basis at our facility. They won't have to interrupt the services at their own facility. Plus, hospitals, as you know, in this economic times, cannot afford to build non-generating funded spaces and simulation labs. That's what we can offer here. So we would like to offer that to them and just to enter into a stronger partnership. Also, continuing education units, nurses, doctors, pharmacists, all have to have CEUs to keep their licenses. We can also offer that to the credentialing agencies to offer their continuing education credits here.
So this really is going to have a huge impact on our entire county.
It is, and again, the simulation that we're talking about is so real that, for instance, the North Carolina Board of Nursing has looked at simulation labs. These are not just dummies that we're talking about. These are simulated mannequins, if you will, that truly resemble a real human and their human ailments. But it will be so real that the Board of Nursing says that they will give us 20% of clinical time credit for a simulation lab of this caliber. So those difficult areas to provide for students, those labor and deliveries, those specific kinds of post-op care that some students may get, some students may not, as a result of the acuity in the hospital. What's the patient's status in the hospital? We can now guarantee for a graduate that they've been exposed to all the critical clinical elements that they will need to be ready to work as a healthcare professional. We won't have to guess that they have not had what they need.
And how important is it for all of the health sciences areas to be under one roof instead of spread out kind of over campus?
Extremely important. We talk about in healthcare providing care from an interdisciplinary approach and a team approach, yet we educate our students in silos. So having this building will actually be able for us to exemplify what we are trying to do in healthcare, where we have classes together. You may have a guest speaker, let's say respiratory therapy was having a lecture on breathing techniques. Well, you can invite your nursing students or your EMS students, and we're all in the same place. We'll have enough space to house something like that, or conferences. So it's going to be extremely important because as you walk through the facility, it will be open. So students will be able to see surgical technology doing their thing in the OR. Students will be able to see respiratory therapy administering ventilation therapy. They'll be able to see the nursing students do dressing changes. So each discipline would be able to kind of rotate through and get a feel for what happens outside of their particular discipline.
And tell me a little bit about the observation and how it's more than just really observing.
Yes.
It's a learning opportunity as well.
Yes. Dr. Overman alluded to simulation as sort of an upcoming methodology in education. So what happens is students break off into small groups. So there may be 2 students actually performing the procedure and 2 students out in what we call our observation area looking through. It'll be like a one-way type mirror. And they will actually critique other students, not only just to see what went wrong, if you will, but what they did well, and perhaps how they can improve the next time they're able to do the procedure. So it's a very good learning opportunity. It allows for students to give peer-to-peer feedback. When you talk to a lot of healthcare providers, one of the things coming out of school they want students to be able to do is communicate with other healthcare disciplines. So this is a way to get students used to giving feedback and receiving feedback from their peers, not just their instructors.
Which I think would be really critical. We're not many of us are very good at getting feedback, are we?
True, true, true.
So what a great way to learn more than just the hands-on or the technical aspect. They're learning what I hear said a lot, soft skills.
Yes, absolutely.
All right, and now you and I, you've been on this program before, talking about nursing program and the clinical hours that health sciences are required to have. And this, as Dr. Overman was telling us, is going to have, I mean, it's such an impact, it's so real that the nursing board's going to allow it to count for some of their hours, but not all. So how is that going to work? What is the impact of going to other healthcare facilities for their clinical hours, and what can happen back here at the simulated hospital?
This actually is a huge impact for us. We appreciate all of our clinical facilities always allowing us to come in and provide training to our students. However, there's a lot of competition because, as you know, you have your CNA students, you have phlebotomy, you have surg tech, you have practical nursing, registered nursing students all trying to migrate to these clinical areas. So this allows us to give our clinical partners a little bit of a respite, if you will, from having so many students visit. At the same time, allowing us to meet our accreditation hours where students have to have a certain amount of clinical hours. So it's a wonderful opportunity that we can kind of balance all of this, not only for our clinical partners, but for our students. Clinical is anywhere from 6 to 12 hours. So imagine trying to locate spaces for a class size of 35 students. You may have to have 4 clinical groups several days a week to be able to meet this. And of course, it would reduce the student travel. You know, economically speaking, our students sometimes it's difficult for gas traveling, and we don't reimburse for gas mileage, you know, when you're in these health science programs. So this is at least an opportunity that they can come to campus, still get their clinical hours, still get the clinical expertise, as Dr. Overman alluded to, what we like to call high risk, low volume type of cases where we may not see a lot of them here, but it's very important that our students would at least begin to learn how to manage those crisis situations. So we're just looking forward to it. It's going to have a huge impact on, I think, the education of the health science program and abroad.
Tell me a little bit about those high risk, low volume, because we were talking about that, like they, in their clinical setting at a working hospital or wherever, they may not see some of the very specialized things, which means when they get out in the real world, they may not have experienced that. But you guys can take care of all of that.
Well, especially in this area, pediatrics. Both Andy Penn and Moorhead, you know, do a great job with taking care of patients, but you don't see a high volume of pediatric patients. So if you have a sick baby, most of the time they're going to go to Baptist or Cone or some other facility. So our students, if they're not doing clinicals there, will not get that opportunity. So we'll have a simulated, a baby sim, we call it, we have one now, that we can have those respiratory conditions, some of your critical conditions, and the students will be able to practice and learn how to manage. The one thing about simulation, it's not just focused on the patient. We have actors where the family members are there and they may come in hysterical. The students got to learn how to deal with mom and, you know, she's being hysterical, how to communicate to the physician to get the orders, how to be in charge with other ancillary service. So it's just a great opportunity. So pediatrics would be one of those cases that you won't see much here in this area.
So just tell me from your perspective, as far as the teaching aspect, what kind of impact is this having on your faculty I would think it's going to impact some kind of changing the way they do things.
I agree, and they're excited because with the building of the new, or renovating the building, we're upgrading a lot of our technology, the wireless aspects and components, so that we can have mobile classrooms, if you will. And the training that goes along with the simulation is a great opportunity for our faculty. We are planning to have what we call a director of this simulated facility, where that person would be in charge of scheduling, coordinating, and the training, and really being our lead person on that. So faculty, the feedback we're getting they're very excited. We like to have as real as possible situations, because we want our students to be workplace ready. It's nice to simulate the sound of the oxygen, but we'll be able to plug the suction canister in and actually have air compressing coming, where we can do the suctioning. So they're excited about having this type of technology to be able to train. It takes our training to the next level.
That is fantastic, and we are so excited. It's happening right here in Rockingham County.
Yes, ma'am.
Thank you so much, Dean Morris. We really appreciate you joining us and telling us all about this. And of course, as we've mentioned, it gets started hopefully in May of next year, and it's in phases, and it's donations that are going to help make this possible. So it's exciting for our county, and we really appreciate it. We'll be right back.
Thank you.